Let's talk UKMLA PLAB 2. Let's talk data gathering. What is data gathering all about? How do I approach it? What is the thing that I need to be doing to try and score as many marks as possible? I'm Dr. Arora from Arora Medical Education. Currently an academy is running, which is why I'm a little bit quiet. And over the last few days, we taught a lot about how to do a focused yet complete data gathering. So data gathering, firstly, is not a history. Okay, you're not going in to do a history. History is kind of undergraduate stuff. Can you do a PC, HPC, drug history, allergy history, social history? That kind of protocol-driven process is not data gathering. Data gathering is all about how do you gather data in order to take this story forward in the second half. Data can be in the form of clinical data, non-clinical data, mind data, life data, ethical data. How do you gather it all up with appropriateness, with good time management, without asking lots of questions that make no difference, to be able to set yourself up for the second half? Now, it can come in several forms. Number one, the history taking part might be a core component. For example, if it's a new presentation, someone's come with a new pain, for example, you need to, of course, do quite a bit of history in that case to try and work out things like differentials. So you might use mnemonics like Socrates or Arora to try and work out the story. That's fine. So history taking is part of it. However, there might be a case of somebody's had a condition for a long period of time, no new symptoms. You don't necessarily need to go and do a full history from 20 years ago when the case started. So the history taking part is part of data gathering, but you don't need to do all of it every time. Secondly, you also gather data from examination. That comes under your data gathering part. You're gathering data through examination to help you make decisions in the second half. Thirdly, data gathering might come from certain investigations you do early on by the bedside, results that you can get there and then, things like a urine pregnancy test, things like an ABG, for example, things like an ECG, for example, things like doing a capillary blood glucose. You are gathering data now to help you take that story forward. Fourthly, data gathering might come from results that are given to you. So you might get a full blood count result, you might get an X-ray result. How do you gather all of that data to process it to decide what to do next? So data gathering is all about gathering data, not just taking a history. This is one of the most important things that we talk about at the academy. We've had lots of role plays. There's currently role plays going on right now, focusing on things like data gathering. So if you're practicing your PLAB 2 UKMLA role plays, make sure you understand what data gathering is and make sure you tailor it to get all of those core issues to help you go forward. I hope this makes sense. #CampusWillPass. We'll see you at the academy.